Hey guys, I'm filming this video today because there's always a lot of questions about drains. So let's talk about drains. We've got a drain set up over here. I'll talk to you a little bit more about this. We'll have Jane show you how to remove them and stuff. Why do I use drains? So drains are something that I use and we use it all throughout surgery for a number of reasons. The most common reason that I use drains now is after an ultra high volume liposuction, particularly of the legs and particularly of the thighs. What drains do, they're a closed silicone drain. They go in through the skin and they're sewn in with a suture, and they go into areas or pockets where fluid can accumulate. So basically, after I do an ultra high volume liposuction case, I've taken out 10 liters of fat, let's say, from the thighs. The skin's kind of dangling, the fat used to live underneath it, and then the muscles are beneath that. We put a drain into that space so it doesn't fill with fluid and you don't get what's called a seroma. A seroma is a collection of fluid underneath the skin. It kind of feels like a water balloon, and it's really annoying when it happens. Since most of my patients are from out of town, and if they get a seroma, there's no way to deal with it, putting in drains is the best way to prevent that from happening. It's not always necessary, and I don't use many drains, but when I do, that's why we use them. You can shower with your drains. There's really not much to do to take care of them. You do have to record how much comes out of them, but they're pretty easy to care for. Some of the best ways to have drains, you can get a little lanyard and snap the drain to the lanyard when you're taking a shower. Sometimes you got to put a little bit of antibiotic ointment around where the drain goes out of your skin, and you're going to record how much output comes out every twice a day. And then basically what you're going to do, how you do that, is you're going to take the drain, you're going to undo the cap here, and you're going to pour out the fluid into a little measuring cup. And we're going to want less than 30 mLs per day for 2 days in a row before we can remove the drain. Drains are really annoying. A lot of people hate having drains. I hate putting drains in, but they are the best way I know of to prevent seromas. Sometimes in the drain, you'll notice initially after surgery, the fluid is a little red, and then it gradually gets clearer and clearer over time, and that's normal. Sometimes you can have things in your drain. Sometimes you'll see like fibrin clots, or you'll see like little things that look like worms in your drain. Don't worry, that's not a bacterial infection. It's not a worm. It's just your body's clotting mechanism that gets caught up in the fluid. It's all pretty normal. Yeah, so that's kind of an overview on drains. Now we're going to show you how to remove a drain. All right, so we got our drain set up here. So when you have a drain, what you want it to do is, you see how deflated this drain is now, how pressed in it is. So this is like a potato chip. It should always be pressed in that much. And now we're going to show you what it looks like kind of when the fluid goes into it a little bit. So we're going to clamp it. We have it hooked to a little thing of Gatorade. So it should suction the blue Gatorade up into it. Perfect. Now you see what it's doing. It's in a little bottle of Gatorade, and there's some blue Gatorade that's getting sucked into the bulb. And that's what it does. It just applies a gentle suction underneath the skin and everything. But you want to make sure your drain is pressed in like that. You don't want any air in the drain if you can avoid it, because then it stops suctioning. So the more compressed it is, the better it is. And this is kind of what your drain bulb will look like. That white tab, so if it looks like that, if it looks like a grenade and not a potato chip, then that's problematic. So then you want to take the top off, squeeze it, and you're going to put the top back on, and then it should hold suction. If it doesn't hold suction when you put the top back on, let us know. You can contact us through the portal. All right, so now we're going to show you how to remove this drain. So if you have this in, you pretend that that blue towel is your skin. And on the blue towel, there's going to be a little black suture. We might even be able to zoom in and show you. Okay. So that black stitch needs to be cut. So you can use any kind of scissor. You can use a knife, anything you want. We have a little scissor. And anywhere along that stitch line, you're just going to make a little snip. And then it should be cut, and the suture will likely unravel. And that's pretty much it. Super easy. Once the stitch is out, the drain will pretty easily pull out. It shouldn't be under very much resistance. It's a smooth drain, and it just pulls out. But it's a nice round drain, silicone drain. It'll slide out really easy, and then you're done. You put a little bit of antibiotic ointment over the hole that it made, and then a little Band-Aid on it. And you can shower as you normally would, soap and water over everything until it heals. It works really well.